I'm Quinn. Welcome to my channel. Now, you're probably wondering, what is EDS? EDS stands for Ehlers Danlos Syndrome. Which, okay, let's go a little bit deeper. What does that mean? Ehlers Danlos Syndrome is a group of connective tissue disorders that are genetically inherited. They present as chronic in nature due to the fact that, well, they affect a large amount of body systems. As Ehlers Danlos Syndrome is genetic, you are born with the condition. You do not catch it from someone you meet on the street. You do not age into the disorder or anything like that. Each of 13 types of Ehlers Danlos Syndrome have some very unique characteristics of their own. That's how they are characterized into 13 different types, for example. But some of the general characteristics include hypermobile joints, tissue fragility, such as muscle tissue, as well as stretchier than usual skin. And while these seem like they might be quite bizarre symptoms and everything, I urge you to think about how the body works and everything. If you think about how the body is made up in terms of proteins and the like, we end up at something called collagen, which, if you think about it enough and simplify it, as it were, is a sort of glue in the body. Or at least I like to think of it as a glue. And, well, with Ehlers Danlos Syndrome, collagen is produced improperly. Well, without a building block of glue to hold everything together in the body, how does that body stay together? Not very well. So, on a little bit deeper of a level, collagen builds up really important things to your body, like bone marrow, skin, as well as protecting your organs, protecting your blood cells, really protecting a lot of very important things that without those protections, you would be in a lot of danger, right? Well, so if you imagine having faulty collagen, there can be a lot of problems. Well, there are a lot of problems when you have faulty collagen. Let's get into a few of those. As I had mentioned earlier, some of the diagnostic criteria for Ehlers Danlos Syndrome included the tissue fragility, such as muscle, as well as skin hyperextensibility. So if I showed you how stretchy my skin was, for example, or as well as how I could, for example, dislocate a joint on command. So, those are some of the symptoms, but what else can happen? Well, a lot of different things, and it's going to vary from person to person. Ehlers Danlos Syndrome does affect everyone differently, and I think that's really important to know. So, there are a lot of things. Not everybody is going to dislocate joints every day. I do, but not everyone does. Not everyone's going to have muscle or tissue fragility. I have some of that, but not a lot. And for other things, right? It can cause major organ issues as well. You know, it can cause a lot of different symptoms, right? Your blood vessels can burst inside veins. It can cause a lot of different issues that can be super serious if you're not, well, being taken care of or being taken seriously. That gets on to my next point. Ehlers Danlos Syndrome isn't really well known about in the medical community. Not well known about enough for how serious it is. In my experience, and I know a lot of your guys' experience as well from reading forums and testimonials and things like that. Have met doctors that don't really know what Ehlers Danlos Syndrome is, and have had to advocate for yourselves and really do a lot of the legwork for things like that. Well, so, why is that? Why is that a thing? Why do we have to do it? Well, so let me get into that. Ehlers Danlos Syndrome is rare. We know that. But should we really have to do all of the legwork for it? It's a debate of ethics. Not going to get into that right yet. But the matter is, when we're doing the legwork, a lot of doctors haven't seen a patient with Ehlers Danlos Syndrome. Again, it's rare. So maybe they were taught about it in med school. That's okay. Med school is a good place for teaching. But because it's so rare, it's almost assumed as if we, the rare patient, are never going to occur. We are a statistical outlier. And statistical outliers are thought to rarely, if ever, occur. And that is an unfortunate reality. If you teach someone that a statistical outlier doesn't occur, then they'll never be prepared for it. Well, so that goes back to a story. Why are Ehlers Danlos Syndrome patients called zebras? Well, it's a little bit interesting. EDS patients are called zebras because of the fact that doctors are trained to diagnose the simplest causes. If a patient has trouble seeing, for example, and they can't read their books anymore as much as they used to, they might just need new glasses. So if you hear a hoofbeat, assume a horse, because it probably is. Well, Ehlers Danlos Syndrome patients aren't quite as simple as that. At least, not usually. If you assume a horse every time with an Ehlers Danlos Syndrome patient, we are rarely going to be treated properly, if ever. For that matter, we are called zebras, because as most people would know, zebras also have hooves. Now, back on to why a doctor may not understand a patient with Ehlers Danlos Syndrome. Again, they may have seen it within medical school. That point, however, may be moot if they don't know what they're looking for and have never seen a patient with Ehlers Danlos Syndrome. Again, textbooks do not equal real-world study, and that is a hard one. So, they may be looking for a patient who fits too finely within lines that, unfortunately, can be a little bit moved, shall we say, because some patients are going to fit every symptom, every diagnostic criteria point to a T. Other patients will not. And this unfortunately goes to prove a point within the chronic illness, chronic pain, and disability communities. We are unfortunately, many of us, going to go through this at some point in our lives, if we have not already, be seen as attention-seeking or otherwise, because we will go through a test, get blood drawn, do some sort of exercise or whatever to prove to a doctor that we need the care, and a result will come back normal. We will be told that that result is normal, it is supposed to be reassuring. It has to be reassuring, but it is not, because we know something is wrong with us. And that is the unfortunate reality, because when that result comes back normal, it is a devastating blow, because results after results sometimes come back normal, and it becomes not good enough anymore when you've done it time after time. It comes to a point where you know something is wrong with you, and labels can be placed upon you, such as hypochondria and drug seeking and other things that just don't go away so easily. And you know your body best. You have to know that you know your body best. Then you need to sit down and reassure yourself, because you will always be your own best advocate. But I can assure you that this journey is worth fighting for, that you deserve to be heard. But when your symptoms are labeled as psychosomatic, when you get labeled as a hypochondriac, things get really tough. Because then all of a sudden you can't as easily get the diagnosis you actually need. Doctors are less willing to listen. It does get difficult. It becomes a harder road than it needs to be. It isn't always as easy as it needs to be for patients like us who do suffer a lot. And this is the plight of the chronic illness patient, the chronic pain patient, the disabled patient. We go through undue suffering, and it is not good enough. It is not. There is a system that needs reform, and we can do it, but there are steps to take. But first, how do you get diagnosed with Ehlers Danlos Syndrome? By now, I think you'll have some ideas whether you have it or not. A good way to get diagnosed, at the very least, is by talking to your GP, your care team, your doctor, whatever you have. Not everyone's going to be on the same level of knowledge, but it's a good start. Tell them about your symptoms. Tell them about why you think you have Ehlers Danlos Syndrome, or why you have what you have. Make sure to tell them about what you've been experiencing. Once you're talking to your doctor, you can be as honest as you need to be. I recommend having kept a symptom log or journal sort of thing for a few weeks, maybe months prior, if you're really building up to that appointment. But I highly recommend keeping all of those things in order, maybe a pain log, anything like that. What your days are like, where you have the most pain, with what motions you have the most pain, all sorts of things like that. It's really useful to be able to tell your doctor with what sorts of things you have pain and what sorts of things you do not have pain, for example, and they may be able to refer you to a specialist. So, once you're actually at an office where someone can do a diagnostic assessment on you for Ehlers Danlos Syndrome, what does it look like? Well, one of the first things they're going to do is get your Baton score. What is a Baton score? Well, it's a bit like a flexibility test in certain joints. So, why is this? Well, one of the commonalities, as it were, in pretty much all of the types of Ehlers Danlos Syndrome is hypermobility, joint hypermobility, and so they want to test that. Well, to do that, they're going to get your Baton score. Next, your doctor or specialist may ask you about your personal medical history. This is pretty important to be honest about and to not leave really any details out. So, for example, they're looking for things like, so big ticket items really. Things like if you've had, if you've dislocated your hip and had to have it put in at the emergency room 3 or 4 times in the last year. Or 3 or 4 times in general. That's a lot of times to have your hip out if you don't have Ehlers Danlos Syndrome. So, things like that. Or if you've had surgery on your shoulder for a labral tear. Something like that. Those would be big ticket items. Next, your doctor or specialist will probably want to do a skin test. In fact, they definitely will want to do it. But what that means is they will check your skin to see how stretchy or hyperextensible it is. They'll also probably check how smooth or imagine like velvet-y soft it is. They also will probably check for wound healing. For example, if you have any surgical scars, how they've healed, if they've healed well, for example, or if they've ever started to open back up after surgery or anything like that, because those would also be signs of Ehlers Danlos Syndrome. And finally, you'll be asked about your family history, probably quite extensively, because you'll be, well, it's actually very important in ruling out things that aren't Ehlers Danlos Syndrome, things like heart failure, organ ruptures, really big, scary things, like if your family has a history of them, things that look a lot like Ehlers Danlos Syndrome at first, but actually tend to be other connective tissue disorders, and if you have them, you want to catch them early. And in regards to the conditions that can be caused by Ehlers Danlos Syndrome or made complicated by them, I have a list that I'm going to read off. Yes, I'm cheating this time. I'm reading a script. And I'm just going to pop up a list on screen. It's probably just going to scroll. Tethered cord syndrome, Chiari malformation, adrenal insufficiency, osteoporosis, asthma, mast cell activation syndrome, craniocervical instability, atlantoaxial instability, spina bifida, sleep apnea, scoliosis, TMJD, heart valve issues, fibromyalgia, CRPS, auditory processing disorders, thyroid issues, MS and other autoimmune disorders, IBS, incontinence, Raynaud's phenomenon, insomnia, syncope and presyncope, migraines, PCOS, endometriosis, food and drug allergies and sensitivities, bleeding disorders, strokes, aneurysms of all kinds, gastroparesis, thoracic outlet syndrome, brachial outlet syndrome, seizure disorders and epilepsy, fallen arches, sciatica, cerebral spinal fluid leaks, and a whole heck of a lot more. In 2021, doctors and the entire medical field really don't know enough about Ehlers Danlos Syndrome. Of course, there are specialists who specialize in it and the like, so they will, but a majority of the field still does not know. And that is in itself a tragedy. What can you do about that? Well, if you suspect you have Ehlers Danlos Syndrome or a family member does, there are some important things. Making sure to be an advocate for yourself or making sure they can be an advocate for themselves is important, especially when they're seeing a specialist or a doctor. That's really important because when you can advocate for yourself or when they can advocate for themselves, it makes a world of difference to the doctor. You know, you may have to correct some misconceptions. There may be a lot of them. But oftentimes it's going to make a big difference. You know, self-diagnosis and checking yourself against symptoms and everything are great tools. I highly recommend them. I also am going to recommend getting an official diagnosis. This isn't just for insurance reasons or things like that. It's going to assure that you get the care you actually need for Ehlers Danlos Syndrome. It's a complicated condition with a lot of complications, or risks as well, and honestly, you may not develop all of them, any of them, many of them. It could be very different. So, the fact of the matter is that Ehlers Danlos Syndrome is a hard one to deal with. It's a lot. But there are a lot of things you can do about it. There are a lot of treatment options available. One of the major treatment options that's out there is physical therapy. Physical therapy is seen as pretty essential to treating Ehlers Danlos Syndrome. I'm personally a pretty big fan and have been doing physical therapy for a long time. So physical therapy has helped me a lot. Of course, people are going to have mixed results, but I like it. Let me tell you why. With physical therapy and Ehlers Danlos Syndrome, our joints and ligaments tend to be so loose that it helps a lot to build up a series of core exercises and small movements and everything just to hold everything in place, and it really actually does help. I've seen a lot of improvement just in myself, but also I know a lot of you who do physical therapy have seen a lot of improvements. One precaution I can give you about physical therapy is making sure to find a physical therapist who's willing to work within your limits. Now, not that it's not important to find a physical therapist who will push you. You need someone who will push you a little bit, but you also need someone who's going to do work that you can actually do. With that, I recommend finding someone who's aware of hypermobility as a rule, and in general, if you can find someone who's aware of Ehlers Danlos Syndrome specifically, that is the best. If you can, do it. For pain relief and things like that, there are a lot of options out there. There are prescription medications as well as over-the-counter medications. Topicals as well come in the same varieties, prescription and over-the-counter. There's also Eastern medicine, things like acupuncture, meditation, and essential oils. I've had a lot of good luck with those. There are also things like kinesio tapes, which are stretchy tapes that go around core muscles to support them. As well, bracing and mobility aids are going to be personal choices. So some people are going to use braces and things like that every day. Some people are going to use braces only when they sprain something, strain something, stuff like that. In reality, whether you choose to go with medication, bracing, mobility aids, or whatever else, it is your personal choice. Some days will be harder than others, and some days keeping up with other people will seem an impossible task. And Ehlers Danlos Syndrome is not an easy diagnosis to take. I wouldn't expect it to ever be. It was not for me. However, that being said, it is a matter of it gets easier as we learn more about things, as we teach ourselves more and more. If you only have one life to live, which you do, You have to give yourself the best shot. You owe it to yourself. Indeed, why would you give yourself any less? I hope this video really helped you. I plan to make an entire video series about chronic illness and life as a disabled individual. If you liked this video, I'd really appreciate it if you could give it a like. It's down there somewhere, either there or there, and then there's a subscribe down there or there. Appreciate either, appreciate both, really appreciate it.